Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Larry and Belinda Wurn with us. Adhesions, internal scar tissue that can form after injury or surgery, cause serious medical problems such as infertility, intestinal blockages, and chronic pain. While surgery is the usual treatment, it often causes more adhesions. After Belinda Wurn developed painful adhesions following surgery and radiation, she and her husband, Larry Wurn, spent 3 years creating a hands-on physical therapy method to reduce adhesions without surgery. The therapy relieved Belinda's pain and later helped other patients, some of whom became pregnant despite prior infertility diagnoses. Working with Dr. Richard King, a hospital chief of staff, they established a research team to study their results. To date, 18 peer-reviewed medical studies have shown the Wurn technique can effectively replace surgery for various conditions linked to adhesions, including infertility, endometriosis, and pain. A controlled study by surgeons from Harvard, Stanford, and others showed the method reduced life-threatening small bowel obstructions by 15-fold. Welcome, Larry and Belinda. Thank you so much for joining us.
Thanks for having
Thank you
us.
so much for
Yeah,
having us.
absolutely. So let's start. Belinda, if you wouldn't mind telling us a little bit more about your story. This sounds like quite a journey.
Well, I had cervical cancer back in '84, and by the time they found it, it had spread. So they were very aggressive with radiation. I had to go for a lot of internal as well as external radiation therapy,
Yeah.
and it killed the cancer, but it basically destroyed my ovaries, so I never could have any kids.
Mm.
Um, but I started, and within about a year following the end of that treatment, I started having abdominal and pelvic pain and different kinds of symptoms. So I didn't know what to do to get myself out of pain.
Sure. Yeah.
Yeah,
You
Right.
were in so much pain.
Right. And you're a physical therapist, is that right?
I am a PT, yes.
Yeah.
I
So
have been
tell,
since 1975. Yeah.
awesome. So, and Larry, you're a massage therapist, is that right?
Yeah, I became a massage therapist, learning
Because
how to
He could cheat
fix
me.
somebody I love.
Oh, how sweet. Oh, that's great. So tell us a little bit about the journey. It was 3 years, right? Where you guys were looking for how did you even know where to look?
You want to start or shall I?
Go ahead.
We took, well, continuing education courses are offered in physical therapy, and we started with lasers and microcurrent and all sorts of different things, including which were some manual techniques. And every time we would take a course together that seemed like it might help, and usually these were in hospitals in the US or abroad in Europe, they were generally 3 to 7 day courses. We would come home and I would work on Belinda and
Mhm.
would trying to figure out, is that helping or not? Because we
Right.
knew that surgery, and her doctors told her surgery is just going to make things worse. It's going to make more scar
More
tissue.
adhesions, yeah.
Of course. Yeah, exactly.
So I have a lot of building and mechanical background, structural background in that realm.
Mhm.
Belinda is summa cum laude, top of her class, physical therapist, so she's very brilliant,
Yeah.
very bright in the medical techniques, so and terminology and conditions, so and disease modeling, how diseases start and progress. So as we started to find things that were helping, we would examine that more and
Mhm.
that were decreasing her pain. And it took
Interesting.
about 3 years really
Right.
of
Yeah.
course after course
Right.
to develop our work until we started finding that she was able to return to work
Yeah.
40 plus hours a week. So she was doing great.
Yeah, that's really amazing. And so you had like real-time feedback based on Belinda, how you were feeling as he tried these techniques and if something hurt more. Did anything ever hurt more when he was trying various techniques on you?
Not really, not
Not
really.
really.
I'd get a little bit sore, if we worked on one area extensively.
Okay. Yeah.
Um, but wasn't bad. It would go away in a few days.
And
Sure.
we weren't really thinking of developing therapies to treat
Of
other people.
course.
I just want to get my wife back.
Sure.
I've known her since 2 months old, so we
Yeah,
grew up together. So,
that's adorable. You guys are so cute. So it
We've
just
known each other literally forever. Yeah.
That's so great. But it's very interesting to me how the thing that we're called to do in order to make the world better is often the area where we've had our own biggest challenges and then had victory. So it's
True.
really, really great that you guys can take that and then say, I want to share this with the world. That's fantastic. So
Oh,
from a physiologic standpoint, I'm assuming that largely this, because it's a hands-on technique, this is like driving blood flow and healing is in the blood. I'm sure it's a lot more complicated than that. Tell us a little bit more about kind of the underlying physiology of why this works.
well, all the organs in the abdomen and pelvis are supposed to be able to slide and glide over and around each other
Yeah,
as we move and doing all our daily activities, and
right,
also as the organs function,
right.
depending on what system they're in.
Yeah.
And so wherever we feel things feel tight or stuck, or certain organs won't move in a certain direction,
Yeah.
with our hands, we'll stretch those tissues and structures in the direction they don't seem to want to go
Mm,
until things start to free up and move more freely. So
mhm.
it's as if gradually we're slowly peeling things apart that are stuck together that shouldn't be. And as the tissues and organs can move more freely,
Right.
symptoms start to get better and go away, and the organs can function more normally. It's like we're slowly peeling this straitjacket off of them.
Yeah, that's awesome. How long does it typically take? I'm sure it depends on the level of adhesion severity, but like ballpark, how long does it take for somebody to notice improvement depending on what they have going on?
Well, our typical program that we put together just over the years, seeing what worked with most of our patients, was a week of treatment, Monday through Friday, 2 hours in the morning, 2 hours in the afternoon, for a total of 20 hours of treatment. But
Really?
usually within the first day, people start noticing improvements. Things don't feel as tight.
Yeah.
Uh, uh, they're not constipated.
Mm,
Their pain is decreasing. They
right.
start noticing differences by the end of the first day, I'd say.
It's amazing. Are there any additional recommendations that you make? I mean, as you're breaking down tissue that shouldn't be there, essentially, I'm assuming, is there anything that you need to do supplement wise, drinking water, movement, not movement? Like what additional things do they have to be aware of?
Yeah, we suggest that they walk after treatment to
Mm,
get things moving more freely,
right.
and to use this newfound freedom of movement that they've gained. And
Yeah.
we do recommend that they drink a lot of water, because breaking apart these adhesions frees up lactic acid, a
Mhm.
metabolic waste product, into the system. So
Right.
drinking a lot of water helps flush that stuff out of the system. So that'll help minimize, because they might get sore from that. So the
Sure.
more water they drink, it'll help minimize any post-treatment soreness that they might experience.
That's great. So tell us some of your favorite success stories. We'll start with the fertility piece. So you'd mentioned that, and I'm assuming that mostly that has to do with either post-surgery or endometriosis. What kinds of
So,
cases? It's both. Okay.
blocked fallopian tubes and endometriosis. We see
It-
a lot of women with both.
Yeah,
And
A lot of men, of course, with pelvic pain.
sure.
And just backing up for 1 second,
Yeah.
when this first started working for us, Dr. DeVille, we did not know why it was happening. And we were treating women. We'll jump into that in a moment. And when Belinda started getting out of pain, we thought there are other people that need this work.
Right,
And
yeah.
we were shocked that women with totally blocked fallopian tubes, so the first one for 7 years with the same boyfriend that whole time, and she suddenly became pregnant. And
Mhm.
when this kept happening, the chief of staff of the hospital called us in and said, "What is this about opening blocked fallopian tubes?"
Mhm.
And we showed him a half dozen charts. She said, "You're doing things with your hands I don't think I could do surgically." And I said, "Is that okay?" He said, "Yeah,
Yeah,
that's really good. We should research this."
right.
So just jumping back for a second to your prior question,
Sure,
we
yeah.
hired we developed a research team, hired the head of biostatistics at the medical school here at the University of Florida,
Mhm.
and a PhD in histology, what happens at the cellular level of the human body,
Yeah.
and in disease modeling, to ask her, what is it that we're doing? And she said, "Well, when you start to heal, adhesions come rushing in and they start laying down in a random pattern
Yeah.
on top of each other to create a scar, basically.
Mhm.
And that's with you for life.
Right.
Um, Sometimes they stay there, sometimes they'll tend to spread if there's more inflammation over the years.
Right.
But she said, Larry, what binds these little fibers together, and they're well over 2,000 pounds a square inch,
Mhm.
what binds them is a little molecular chemical bond that attaches them. And I think what's happening is you can't be breaking those adhesions. You're not actually breaking them. You could lift an elephant with a square inch of these. They're 12,000 pounds a square inch.
Yeah.
But now they're 12,000. I just found some new data.
Oh,
But there's
who knew?
actually a little bit more than that of these scientists are just amazing what they study.
Sure.
But he said, as you dissolve those bonds, I think you're pulling apart the adhesions, kind of like pulling apart the run in a three-dimensional sweater.
Hmm.
And as you do, and as Belinda said, we get them out walking afterwards, so it moves them a little further apart.
Yeah.
Um, then they don't tend to reattach because there's no more inflammatory process calling on new crosslinks.
Sure, yeah. And so I'm assuming that the reason why you guys focus, I'll get back to the fertility question in a minute, but I'm assuming that the reason why your technique focuses on blocked fallopian tubes and maybe small bowel obstructions is because it's a little more easily accessible based on where it is, because obviously people are going to develop adhesions with all kinds of surgeries, but some things your hands can't get to, right?
Well, that and the fact that we can measure it,
That,
because
yeah,
trying to do research on something you do with your hands is really
sure.
difficult.
Yeah.
But if you can get a dye test beforehand that says, oh, yes, this woman's tubes have been totally blocked for, in one case, one physician's wife, 11 years, and she only had one tube and it had been blocked for 11 years. We had all the films and severe endometriosis, which causes adhesions.
Yeah.
Um, and then afterwards, she either, in her case, she had a baby,
Mhm.
but even before she had the films. But otherwise, when we wanted to test, our scientists would say, well, we'll get a dye test before and after.
Right. Yeah.
You get enough of those, and you can make a
Sure.
statistical result and say, this is your success rate.
Pretty clear data. Yeah, absolutely. That's
Yeah,
awesome. So,
right.
so yeah, tell us some you just told us at least one success story. Any other success stories with respect to fertility specifically before we go on to the bowel stuff?
Here's a cute one, although it has to do with pre-IVF. Because I told you about the first lady who had been infertile for 7 years and she became pregnant, was shocked, and this a friend of ours, a chiropractor, who said, "Do you have anything to do with that?" And said, "We don't know." And he other
Right.
patients, they became pregnant, and then he sent his wife, and she was the one with one tube, and it had been blocked for 11 years, and she
Sure.
came in one day and she said, Belinda, I don't know whether to hug you or hit you because I'm going to be 42 and I'm pregnant.
So this is not the plan.
It wasn't the plan,
That's
but they
funny.
now have a 25 or 26-year-old daughter.
So yeah, it worked out. That's
Worked
great.
out well.
Very
Yeah.
cool.
Another one, and this is actually pre-IVF, but the woman came, we were just starting to see it early on, a lot of successes, and this woman comes in, she says, I'm already scheduled for an IVF. Do you think your work can help me? And
Hmm.
truthfully, we tell the truth. I don't
You
know,
didn't know.
let's see. So we started working with her, and I was treating her internally. And if I'm treating internally, I'm always having another female in the room. We're very appropriate, use
Sure.
gloves, of course.
Yeah.
And I said, that's odd. What's that? She said, I said, your cervix is really curled up and kind of stuck to the vaginal wall on the inside.
Way back.
She said, well, I can tell you about that. What? She said, I've had two IVFs before and they both failed.
Mhm.
And the doctor always is sweating that the embryo is gonna, in the catheter, in that little straw he's inserting to get the fertilized egg in me. He's always worried that it's going to die in the room temperature because it takes so long to
Interesting.
get through my cervix. Can you
Uh-huh.
do anything about that? And I said, I don't know.
Yeah.
Let's see. So I worked on that for a while that day and for a few days thereafter.
Yeah.
And she came back a month later and I said, well, how'd you do? Well, she said, first thing, I'm pregnant this time. This
Aw,
one
that's
succeeded.
awesome.
I said, that's
Yeah.
great. She said, but it was really a funny story. She said, the doctor started to do the transfer and he knew me very well because of
Yeah.
the failures.
Sure.
Before, every time he'd pull the catheter out, it looked like a piece of spaghetti. It was all curled. And she said, the catheter, it just went right in.
Yeah.
real quick, the doctor grabbed the chart to look to make sure I was the right person.
Do I have the wrong chart? Oh my goodness.
And
Because it was so easy to get into her
Right.
cervix. Yeah.
Yeah.
and afterwards, he said that was the easiest transfer I think I've ever done.
Wow.
So that's where we realized that adhesions form anywhere in the body. They can
Absolutely.
form on the outside, within the muscles, within a cervix, or within the walls of the intestines,
Hmm.
creating that stricture,
Hmm.
a narrowing. But it does not seem to matter whether they are accessible, actually palpable to us, or whether we can just get to them kind of like you would to
Hmm.
the run in a sweater from a little bit more distant because they're
Right.
spreading and we can
Yeah.
get to them that way. So
Indirectly. Yeah.
Yeah, interesting. So, as you're talking, another thing occurred to me. So, for somebody totally changing gears, for somebody that has contractures from like some other kind of internal process, I'm thinking Dupuytren's contraction in the hands or maybe Crest syndrome or something like that. Have you ever worked on anything like that?
Yeah.
Yeah. Okay.
Dupuytren's is tough. I mean, the adhesions are really, really thick in the
Yeah.
hands,
Uh-huh.
but we have gotten improvements.
You have. Okay. Interesting. So, I
Yeah.
means just adhesions anywhere as long as you
Adhesions
can get to
anywhere.
them.
Yeah. I mean,
Yeah.
anywhere.
they can and do
Yeah.
form anywhere, anywhere there's trauma or surgery.
Sure. Yeah. Very cool. Awesome. So, as far as small bowel obstructions, tell us some of the success stories for that. And, people are susceptible to these primarily, I would assume, because of post-surgical adhesions, right? Or maybe endometriosis lesions or things like that.
Oh,
Is that
yeah.
normally what you see? Yeah.
Or,
Okay.
many women have had both,
Right.
surgeries and
Sure.
endometriosis. Oh, surgeries
Yeah.
for the endometriosis.
Sure. Yeah. Yeah. So tell
I'll
us some
give
of your favorite.
background and then you tell the story. You can talk
Yeah.
about
Go
grief.
ahead. Yeah.
Oh, okay.
So the background is that bowel obstruction, your bowel is your intestines, of course, is bowel repair generally due to obstruction is the second most common emergency surgery in the US.
Oh, I didn't know that. Wow.
Yeah, according to the Journal of the American Medical Association,
Huh.
just came out recently.
Interesting.
And removal of adhesions is actually the fifth most common emergency surgery in the US. So these are huge problems.
Wow.
And of course, they're life-threatening because you have to
Yeah.
have food or you're going to die.
Yeah.
So the doctor takes you in and says, "Well, we're just going to wait." And I'll let Belinda tell that first story but we're going to wait and see if it clears. And if you can come out of the hospital, you finally can get some food to pass. He says, "That's great.
Yeah.
Here's my card. You'll probably be back. You may be back because nothing's really changed."
Yeah.
If your doctor had to do a surgery, then he or she will say, glad to say we got that cleared. Hopefully, not a drop spilled out during the surgery, because 1 out of 5 patients return to the hospital within 30 days often for another surgery if a little bit leaks out. So we
Mhm.
get peritonitis.
Yeah.
But now I have to tell you, nothing has really changed. Actually, I've probably made it worse because I've done surgery, and that's the
That's why
number
you
one
get
cause of
adhesions.
bowel obstruction.
Yeah. Yeah.
You want to talk about how we got into treating bowel obstructions and
Yeah,
already?
we had this rock and roll singer from California call us one day,
Interesting.
and he said, I've had how many surgeries had she had?
She had seven
Seven, yeah, seven surgeries.
in the last year and a half.
And her last one was like 3 months before, and they were talking about doing another one. And she said, I just can't keep doing this.
Oh
It's just
my gosh.
surgery after surgery after surgery,
They were getting ready to do a Whipple. She said they're going to take out half of my
half of her
stomach,
organs. Yeah.
my gallbladder, everything they said that adhesions can attach to. She said, they're killing me. Can you help?
My.
Said we don't know, but we'll be glad to give it our best shot. So
Sure.
she came in, and I mean, she had only been able to ingest liquids. She hadn't been able to eat solid food in months, in a
Oh,
long time. So we treated her, and after the first day, that night, she went out and had salmon and a baked potato for dinner. She
wow.
was so happy.
That's
Yeah.
amazing. That took a lot of faith on her part as well to
Oh,
say.
she was hungry,
I'm
she just
sure that too. Wow.
and she was brave. She wanted to push
Yeah,
the envelope and
right.
test it.
Yeah,
So
yeah.
She did great afterwards. She did really great. And she hasn't had another surgery since.
It's been 14 years.
Yeah.
And she was a real Janis Joplin type, so she was very much a
Yeah.
go-getter. So you're
Yeah.
proud of her as a woman.
Right. Yeah, that's fantastic. Very cool.
Uh-huh.
So, if somebody is interested in this, you guys are in Florida. Everybody, I obviously flies to you, I would assume, right? Or do you have multiple locations, or how does this work?
We do have several locations, but
Okay.
most of our patients do fly to us. We're in Gainesville, Florida,
Gainesville.
North Central Florida, where the University of Florida is.
Okay.
And they
Okay.
live on a Monday. And again, they're, like I said prior, they're treated Monday through Friday, two
Uh-huh.
hours in the morning, 2 hours in the afternoon with a break.
Yeah.
And we ask them to go out and walk, after their treatment sessions.
Hmm.
And then we show them in the middle of the week, usually on Wednesday, we'll show them a home program of stretches and how to treat themselves using their own hands
Hmm.
to help hopefully maintain the improvements that they gain during the week of our treatment.
Yeah.
So they can go home and work on themselves.
Yeah. Very cool. And price wise, so how much does it cost? Does insurance cover it?
And just backing up for a second, we have clinics from California to London.
Oh,
So and
wow.
and people come in for that 5 days. Insurance may or may not cover it. We're glad to work with people before they ever come in to find out what their insurance will cover
Mhm.
so that they know beforehand because it is a cash program. We'll get into that. Also, about the 20 hours of treatment, we given these little short stories, but this developed over it's been over 30 years now. So the way we came up with 20 hours, and we'll get to the cost,
Mhm.
is that one of the radiologists in town kept seeing these x-rays coming through of women whose fallopian tubes we were opening,
Mhm.
which was really remarkable, considered remarkable. And he called his father, who was a senior researcher at the National Institutes of Health in Bethesda, Maryland. His dad got so interested, he moved to Gainesville, Florida to study us
Mhm.
and to help us with the research. And I said, Dr. Wickman, how many hours does it take? And also, we were seeing people spread out. What if somebody wants to come from the Midwest and they don't
Right.
have that much time? We're starting to see people over the course of 5 days. Does that matter?
Mhm.
And he said, Larry, you open block fallopian tubes, which is our main measure in the beginning. They're tiny. I mean, they're designed to carry a single cell,
Mhm.
the egg, and a few sperm, which are much smaller than an egg. Um, you average opening tubes in 16.2 hours. So let's design a 20-hour program and know there's no statistical difference between whether we spread out treatment or do them in a short period. I think the shortest we've done is 4 days, so 5 hours a day. Treatments is $7,500,
Mhm.
and people put down a deposit, about 10% of that, I think, to reserve a place because I mean, we've handpicked therapists. We don't have any young therapists. Our therapists have been studying for decades before we ever hired them and taught them our work.
Mhm.
So we set them aside for you for half of their week, a
Mhm.
little bit over half of their week. So it's a little pricey, but
Mhm.
like I said, we will work with you to find out what your insurance will pay. Hopefully they'll pay. Sometimes they pay it all, sometimes they pay none. But
Mhm.
you're facing if you really want something that has science backed and
Mhm.
we can look people in the eye and talk to scientists and other therapists,
Mhm.
other patients that we've seen for years, or that's going to save your life. It's
Sure. Yeah, it's worth it.
good
Well,
rate.
also, I mean, when you compare that head to head with how much surgery typically costs, or even how much IVF costs.
How
So
much IVF costs?
putting that
Yeah,
in perspective.
we're a fraction of that.
Yeah.
Sure. Yeah, absolutely. So what have I not asked you guys that you want to make sure you leave with our audience?
One of the you know, do you can I go ahead? Our
Should we thinking about?
our by not our biostatistician, our other researcher did one with disease modeling and histology, she got really fascinated. I was asking her what our success rates were because there are various causes
Mhm.
of female infertility, and I didn't see her for quite a while. She was back in the back going through files, and she said, Larry, I've come up with a chart of 10 years of infertility patients that you've seen,
Mhm.
1,392 of them, I think there was.
Mhm.
And I can tell you what your success rates are for opening blocked fallopian tubes. It's 69% if they've never had surgery on their tubes. And most of those became pregnant. Um, and I can tell you what they are for advanced age. And I said, what do you mean? And for pre-IVF and for endometriosis. The endometriosis was I think 43%, but that included women with totally blocked tubes. So
Wow.
the rates were equal or better than IVF at
Yeah,
really a fraction of the price.
sure.
And I said, "What do you mean about advanced age?" She said, "Well, and you know this well, but your audience may not. Every month that a woman starts to have a period, her ovaries down in her pelvis call on the pituitary, this tiny gland about an inch and a half or 2 inches up in the middle of your head, to give me follicle stimulating hormone. Help those little follicles, those immature eggs in
Mhm.
the ovaries. I need to have one grow into an egg that can actually mature and create a baby, hopefully. And as a woman goes into her later 30s and toward 40, the ovary is calling on the pituitary, give me more and more of that FSH.
Mhm.
Well, when the FSH is over 10, when
Mhm.
they measure it on a blood test, early in the period, doctors won't see you for IVF because they figure you're at the end of your reproductive years.
That's called advanced age
It's called advanced
and
ages.
old eggs. I hate that
It's
term.
I
really
know.
an unkind expression.
Right.
We had no sense at all that we could help that, although we were working the cranium also because adhesions will form anywhere.
Mhm.
And when I talked to Dr. Rice, she said, you have nearly a 40% success rate of pregnancies in women who would be refused IVF
Because of their age.
because of their age, because their FSH was over 10, and
Uh,
some of them were in their 30s. And well, the first one was in menopause when we even got the idea and started to test it. And then we tested for a couple of years, a lot of women, and we were having great success. And then the woman who was in menopause and had that first child now is pregnant with her second child 2 years later. So
Wow.
another kind of advantage that once you're treated, your body just goes back to an earlier state of function, of unbound function.
Yeah.
So there's no need for to try again, like you might
Right.
try with IVF or some other methods.
Right.
Um, that's pretty much it. I mean, there are other conditions. Oh, I have a
Well,
funny story.
Which
You
one?
want to tell the one about the orgasm
mhm.
woman that comes to you?
Yeah. Yeah, there's one of our patients this is a long time ago.
Yeah.
She said, I have a question to ask you. It's kind of embarrassing.
This is several months after we treated her, and she's in her
Yeah.
mid
Right.
40s.
Yeah, she
Great.
called and she said, have you ever heard like I'm having orgasms like I never had before since you treated me? Has
Uh-huh.
anyone ever mentioned that before? It's kind of embarrassing,
Yeah.
but I and
That makes a difference too. Yeah.
so, we talked to our medical director, Dr. King, and he said, well, that's really important because about 60% of women have difficulty with orgasm or can't have an orgasm. So we
Yeah.
need to do a study on that. If we can
Sure.
improve that, that's really important.
Right. Yeah.
And I said,
Absolutely.
no, wait a minute. We're not going there. We're already the weird practice. I'm not going into
Right.
this whole sex thing. He said, no, no, you really have to start keeping data. We can actually measure this stuff. I
Right.
can have the biostatistician create a questionnaire for before and after you treat. So
Sure.
you tell if you're doing well for these.
Right.
There are 6 domains of sexual function for women. We improved every single one of them:
Mhm.
desire, arousal, lubrication, orgasm, satisfaction,
Decreased
and
pain.
pain.
Yeah.
Mhm.
Orgasm was the lowest. It was 56% of the women improved in that, and
Mhm.
pain was the highest. It was up in the 95 percentiles.
Yeah.
Presented to a group at the American Society of Reproductive Medicine. They asked me
Mhm.
to present a group of physicians. We were as shocked to find that everybody we were presenting to, 90% of them were psychiatrists
Oh,
because they thought pain was in a woman's
Yeah,
head.
it's all in your head, right?
We
interesting.
were surprised as they were surprised to find that it's actually
It's
where the women are
Natural.
feeling it.
Yeah,
Yeah.
Yeah.
who'd have thought. So that makes me think of all the physiologic underpinnings here. I would assume that the people who are coming to you are already self-selecting for having had adhesions, and therefore the adhesions would contribute to trouble with orgasm, or do people just go to you because they have trouble with orgasm with no idea that they have any reason for adhesions and they still get better?
Yeah, go ahead.
Okay, generally speaking, women see this data, and also so many women have pain with intercourse, either at the
Yes,
introitus,
that's usually
at
why
the
they come.
opening, or
Okay,
with
got it.
inter, as they say, well, whether or not I become pregnant, I'm afraid I'm going to lose my spouse, or I just want to have pleasure
Sure.
uh, with or
With intercourse. Yeah.
Right.
so
Yeah.
they know they have pain.
Sure.
They're not at all generally thinking, wow, this might help my orgasms,
They
because
don't come
it's
to
not
us for just
something
that.
Sure.
that we tout a lot about. But when you think about it, every single woman, from the time you are first sexually active, you
Mhm.
have non-sterile objects
Mhm.
entering an area that's designed to create life.
Right.
And and so bacteria come in there, they go, wow, warm, moist, dark. This is a perfect place for me to proliferate. I
Sure.
can grow in on the vaginal walls,
Right.
so
Yeah.
that's where we're treating for the orgasm and the
Okay.
sexual function,
Sure.
and or I can matriculate up in through the cervix into the uterus into the whole
Okay.
reproductive tract, and blocked fallopian tubes and
Mhm.
form on the uterine walls, so it creates a propensity for miscarriage because the
Sure.
walls become sort of less hospitable
Right.
when
Yeah.
they're covered by a sheet of adhesions
Oh, of course. Yeah.
than
Yeah, it's harder for
in
implantation
normal.
to stick.
Yeah,
Right. So to connect the dots there, it sounds like what you're saying is that when there's introduction of foreign bacteria, for some women, it can then trigger an immune response that then leads to the typical immune response ultimately is scar tissue. And
Yeah,
that's what you're working on, right?
formation.
Got it.
first first step in healing, right?
Yes.
Right. Okay. And then, so backing up a little bit with the idea of the advanced maternal age and the elevated FSH. So I would again assume that since we're dealing with scar tissue, the only women that would be able to respond positively to this would be those whose ovaries are not responding the way that they should be because of scar tissue, right? And as opposed to for some other reason, or do we know?
Well, what we found, we don't know,
Okay.
but we do know that women who have been diagnosed as submenopausal or menopausal,
Mhm.
40% of them become pregnant when when we treat them.
Sure. But
So
Premenopause.
whether the ovaries are
right.
whether it's there or up at the cranium
Hmm.
or through the dura, because we'll bring that tailbone down, which tends to
Hmm.
free up
Sure.
all the way up into the cranium and
Got it.
maybe take pressure
Same.
off the pituitary.
Okay. Yeah, that's really fascinating because I know that because the ovaries produce more mitochondria or have more mitochondria than anything in your body, most
Really?
of the time, most of the time, the ovaries are, as you get older, there's less and less, there's more mitochondrial stress, and that's what causes women to no longer be able to produce the eggs. And
Right.
they're the eggs, the advanced maternal age, essentially, so that even the
Wow.
eggs that are left aren't going to respond. And then
Well,
because they're not responding, the pituitary shouts louder. So that like that's when the FSH is going up and up and up.
Wow.
But what you're describing sounds like there's a problem in certain cases not with the structures themselves, but with the passage. That makes perfect sense. But it
Mhm.
would only make it would only fit for a woman that also already had adhesions that were contributing to the signal not getting through, which I assume they're self-selecting by coming to you because they have adhesions and then those things improve. So it's just
But,
fascinating. I never
but
would,
also,
yeah,
also girls are born with as many eggs as they're
right,
ever going to have, where
right.
men are constantly producing more
Mhm.
sperm throughout their life.
Right.
We every month we have a period, we have that many, that one less egg, and
Right.
as we get older, there are fewer eggs.
Right. Yeah, yeah, absolutely. So that's certainly true too. It's just, where at what point is there early for women who are go through early menopause? Usually there's a mitochondrial depletion or the signals aren't getting through, one of the two. So,
Fascinating.
yeah.
I had no idea.
Mhm. So,
Wonderful.
what else have I not asked you? Because that was great that you want to make sure you leave with our audience.
I, I
Oh gosh.
I don't know. I could tell you another funny story.
Sure,
It
yeah.
has nothing to do with infertility or even
Right.
bowel obstruction, but it's a
Mhm.
remarkable story. This head of workers' comp for the state of Florida sends us this young man. He's about 26 and he's fallen at a construction site. And the doctor said, send him everywhere else in
He
town.
landed really hard on his butt and his tailbone.
And I wasn't going to say that, but um,
Well, you said everything else. Why not?
okay. That's all right. So he comes in and he's kind of dragging one leg behind him and he's got torticollis, one shoulder is up like this and his hand is shaking. And he's just a mess. He's just in a terrible neurologic mess. And we started working with him. We just kind of went into the lesion and just listen and follow. And we got his gait so that he was walking normally. He went to light duty work and got his arm so he could got his shoulder down and he got to progress to medium duty work. But meanwhile, all this time, every single day, he had severe headaches. And this has gone on for over 3 years. And I'm going, how you doing? Well, I'm doing good. I just got this awful headache. He got deep Southern accent. And so Belinda and I, this is back in the beginning,
Yeah.
and every day this is what we do. We can't have children. This is our life, helping people. We're so
Right.
fascinated, and we're talking about it. And I forgot which of us said to the other, you ever notice when you're tractioning his head, because so much of headaches seems to come from right here at the
Base of
cranial
the
base,
skull. Yeah.
that it kind of almost feels like it's pulling your hands back. Yeah, yeah, I know, Belinda said. Well, what do you think that is? I don't know. Well, do you think maybe when he landed on his tailbone, it pushed his tailbone forward, that pulled down on the entire spinal
Oh,
cord, the dura
Pulling
that
his head
surrounds
down.
everything, and that's
sure.
and that's maybe what's causing the persistent headaches.
Yeah.
Yeah, well, actually, that like then for the engineering of it, that makes sense. Well,
Yeah.
what are we going to do about it?
Yeah.
Long silence in the car,
Uh-huh.
and so we said, "Well, what if one of us puts on a glove and goes into his bottom and pulls his tailbone back
Right.
down, while the other one is tractioning his head? Do you think that might help?"
Stretching the
Sure.
whole spine.
Well, it
Yeah.
might work, but it sounds a little weird. Maybe we better call his doctor first. So we called his doctor. We didn't want to get in trouble with him. He's the head of workers' comp for the state. So the doctor is very busy, and he doesn't get back to us before the young man comes back in. How you did? So he comes in on a Thursday morning. How you doing? Oh, I'm doing all right. I'm doing all right. I'm working. Yeah, I just got this awful headache. I just can't get rid of it.
Mhm.
So Belinda and I consult outside the room whether we're working for the doctor or the patient, but we just hate to see anybody in pain. So
Mhm.
we told him what we were thinking.
Right.
And I said, it might just be uncomfortable for 5 minutes, might not do anything, but it might help. So, well, if you think it might work, let's just go on and do it. So we
He's
just
willing to try anything.
went
Yeah.
on.
Oh, sure. Desperate.
And then we just went to the rest of our patients, and unbeknownst to us, he goes back to his doctor on Monday morning and tells him, and his doctor says, "They did what?"
Sure.
But
Yeah,
if you think about the anatomy, it makes sense.
Well, that's
yeah,
it.
sure did, sure did. Found out two things right quick. And yeah, I understand this is a country kid. And the doctor said, "Well, what'd you find out?" And he said, "Well, number one, I ain't gay." No, no, I ain't going there in my life. And the doctor's kind of trying to hold it together. And he said, "Well, what else did you find out?" And he said, "I found out what a great doc you are." And he said, "What do you mean? To know me, to send me to them people? Because
Oh,
not only they got me back to work, but I ain't had a headache since they done that. I've had one every day for 3.5 years. I ain't had one since."
gosh, that's amazing. I love how you guys are thinking big picture physiology of like, let's just go back to first principles, reason through what happened, reason through what likely is wrong, as opposed to it seems so common in the medical field where people will say, this study says if you do this thing, it will help this condition, but they're not looking at the case of the
That's
person that's in front of you and reasoning through what happened to this person. And let's
Right.
figure out how do we help this person? Like that's what medicine should be. I love this. That's great.
Yeah.
So,
right.
uh, so
And you, naturopaths, you do that,
we're trying. Absolutely. Yeah.
Yeah,
you do.
that's wonderful.
I have another SIBO story, but I could save it for another
Sure.
time.
No, please. That was good. Let's
All
have
right.
it.
So one day I get a telephone call, and this is Dr. Sandberg Lewis.
Uh-huh. Yeah,
Yes.
yeah. Hmm.
Okay, oh, so
Right.
so yes, I've never heard of him. He said, "I want to know what you're doing with our patients." And, uh-oh.
Uh-huh.
What did I do now? Said, "What do you mean?" He said, "Well, this patient was dying. She has SIBO, it was
She
eating
was in
her
a
food.
wheelchair. Yeah.
She was went down from 130 pounds to she was about at 89 pounds in a wheelchair when she saw you.
My goodness.
None of the medications her naturopath was giving her were working, or they'd work for a few days, but then they'd stop.
Then
And
come back.
suddenly she saw you. Now she's out of the wheelchair. She's walking. The meds work.
Wonderful.
And I want to know what you're doing."
Uh-huh.
And I said, "Well, we're free in adhesions. I mean, we do free
Mhm.
adhesions of, well, what is SIBO?"
Mhm.
And he
Oh, you
says,
didn't know. Oh, wow.
No, what SIBO was then?
Oh
so
my
I said,
goodness.
"Oh my." So he flies here. He's a head of gastroenterology, of course, at the university in Portland,
Yeah.
was at the time.
He came to visit us.
So he flies across country to Florida. I get
Yeah.
him together with the chief of staff of the hospital and a couple of the biostatisticians to figure out what's going on.
Right.
And we figured out that what's happening is that the rifaximin or the nutraceuticals, whatever they're giving to this patient to knock down and kill the SIBO bacteria,
Mhm.
is working,
Right.
but that the
Comes right back.
bacteria, because of adhesions in her gut,
Yeah.
were not able to exit her body, so they were reproliferating. So
Interesting.
that we
Okay.
developed a protocol for people with long-standing SIBO. They'll start their meds before we treat them, continue
Mhm.
them through the 5 days of treatment, and continue them again for another several days
Yeah.
after
Mhm.
Yeah.
treatment.
Usually we suggest they start 3 days prior to our treatment, during our week of treatment, and
Mhm.
then finish. Usually it's a 10-day course,
Mhm.
finish the last 3 or 4 days
Yeah.
after our
Mhm.
treatment finishes.
Yeah.
So she went back up to 135 pounds and out of the wheelchair, and
Oh,
it was
We started
wonderful.
seeing a
So
lot of SIBO patients.
I'll bet. Oh,
no
that's wonderful.
SSL, and he asked me to address the naturopathic conference for the annual naturopathic conference and
Very
share.
cool.
So
Oh, that's
there you go.
wonderful. So, and in that situation, so was in that particular patient's case, did you find out that there was a reason for her to have had adhesions, or was it just the SIBO itself
She
that
had
made
had a surgery.
she'd
She
oh,
had,
okay,
so she had adhesions from that surgery.
got it. Okay, very interesting.
Yeah.
And of
Okay,
course, SIBO itself can cause an inflammatory response that
sure.
causes adhesions.
Any sort of
How the body
bacteria.
heals.
Right. Yeah, that makes sense. So, where can people go who want to learn more about you, find your locations, more about your technique, all that?
They can go to our website, www.clearpassage.com.
Awesome. Yep.
or they can call us at 352
Uh-huh.
336
Uh-huh.
1433.
Okay, awesome. I will put both of those in the show notes. And this has been really inspiring and eye-opening. I really appreciate you guys' time. Thank you so much.
Thank you for having us. We appreciate it.
And
Yeah.
if you have patients who think, I don't know if this is for me or not,
Yes.
let them go to the website, complete a medical history form. We'll go through it, talk with them,
Right.
and figure out together, that makes sense or it
Right.
doesn't.
Yeah, we can set up a
So
free,
we don't push people into anything.
yeah,
So
we can
Right.
set up a free 30-minute phone consult with
Right.
me or one of our other therapists.
Yeah, that's awesome. All right. Thank you guys
thank
so
you
much.
so much.
All right.
Yeah.
Have a great day.
Yeah, thanks. You
Thank
too.
you.
Bye-bye.